For the second part of our anatomical position terms, we're going to look at posterior body landmarks. So I've turned our skeleton around, and again, you can use your skeleton at home or your child or your spouse or your friend. And we're going to work through these together as well. So some of them you'll see are duplicated. The first one is acromial, which you might remember is the point of the shoulder, acromial. Brachial, do you remember where brachial is? Brachial is actually between the shoulder and the elbow, the brachial region. The next one is a new one, the calcaneal region. This is actually down at the ankle. The calcaneal region is related to this bone that's fairly large called the calcaneus. And the calcaneus is one of the largest bones that we associate with the ankle region. So it's calcaneal region. Again, cephalic, so we'll slowly pan our way back up to the head region, the cephalic region. And when we think of cephalic, this actually might help us learn the next term, which is dorsal. And dorsal is anything along this posterior side, again, often in reference to something like the abdominal cavity, located in the dorsal region of the abdominal cavity. So I always think of the dorsal fin of a shark. And the belly side, I don't believe they use that term yet, but the belly side is actually the ventral side. So dorsal would be along the posterior region, and then ventral along the belly side. Femoral, again, the thigh to the knee. Femoral associated with this really large femur bone. Everyone's favorite region, the gluteal region, which again, this would be related to muscle that would envelop these hip bones and form the buttock muscles. Gluteal is a landmark, though, in and of itself. These sort of large vertebrae along the base of the vertebral column are called lumbar vertebrae, and the lumbar region is the lower back region. And hopefully you haven't had any pain there in your lower back, but certainly that can be a difficult region because there are a lot of nerves that would run to the legs, and so if you pinch those, it can cause a lot of pain. Manus is the hand, and I'm not entirely sure what they put on the posterior side because it's really related to both, but manus, M-A-N-U-S, for the hand region. Moving our way kind of back up a little bit on the back of the skull, or if we want to be more accurate, the dorsal side, we talk about the occipital region. The occipital bone is a distinctive bone. Again, it's not very obvious on the skull, but we'll talk more about the skull bones later. Occipital. The olecranal region, O-L-E-C-R-A-N-A-L, is the posterior of the elbow, olecranal region. So we can use that as a landmark. Otic, O-T-I-C, you may be familiar with an otoscope, which would look in your ear. So otic. Again, I can't really point to it accurately because it would involve the buttock region, but the perineal region, P-E-R-I-N-E-A-L, which is really between the anus and the genitals, so a landmark during delivery of a child or some other kind of surgeries. Plantar, P-L-A-N-T-A-R, this would be the sole of the foot. You may have heard of things like plantar warts, P-L-N-T-A-R, the sole of the foot. Behind the knee, popliteal. Popliteal, we talk about the popliteal artery later on, a place to take the pulse. Sacral, this region, this particular bone is called the coxal bone, and we talk about the sacrum, and the sacrum is this bone that sort of lies between the coxal bones. So the sacral region, sometimes describing this as looking like a heart. There is a tiny little bone that we think of as the tailbone that's actually separate. It's called the coccyx, but the sacral region is sort of between the hips. Scapular, again, using the landmarks of the bones. The scapula is the landmark for the scapular region. The scapula is kind of an interesting one because it was described as looking like a shovel, and in fact, early peoples used the bones as shovels and spades. And there is this sort of ridge. We will do some of the landmarks later on, but you can see the scapula it would really be enveloped in muscle, and you can really feel that ridge on your own back. That's really the only part of that you would feel. The Surreal Region, S-U-R-A-L, this would be the calf region, the Surreal Region. So we had femoral and then surreal. And then lastly, vertebral. And vertebral is really related to anything along this vertebral column, which as you're reading chapter 1, as you're kind of looking through this laboratory manual, you're learning that having the vertebral column protecting that nerve cord is one of the features of animals, and in particular what we call chordates. And we'll talk about these individual vertebrae later on. There are usually 33 to 35 vertebrae. Most of them are distinct, individual from each other, but then there are some that are fused together. So what they ask you to do next is to label some of the diagrams, and I'm going to reiterate that. I'm going to suggest that you do those because I'll be having a quiz on Blackboard at the end of the week. I'll be releasing those on Friday. I give you usually between Monday and Friday to kind of read the chapter and read through the laboratories. And so that particular one I'll open up on Friday, and you'll have until Sunday to complete it. So using those anatomical terms to label different regions of the body. So try that.